Hi, everyone. I'm Jess Chu, VP of Marketing here at Trella Health. And today we're talking targeting strategies with Teresa.
Hi guys, I'm Teresa Buglione. I'm the Director of Services here at Trella Health.
Well, we saved the best one for last, or maybe the juiciest for last of this initial targeting series.
Yeah.
All right. Well, without further ado, let's jump into competitor affiliated. So tell me, Teresa, what is this strategy? What type of physicians are we talking about here?
So with physicians who have what we call a competitor affiliation, they're usually our competitors in our area, our territory, who are sending physicians who are sending patients to our competition. So that physician tends to send a good bulk of their patients to our competition. We call that competitor affiliated. And a lot of folks think when they see that, oh, well, they have a strong affiliation to our competition, that there's no opportunity for me to be able to partner with or have a working relationship with these particular physicians. That's just not the case. There are different strategies you can utilize when looking at the metrics on the home health and the hospice side in order to show this physician you may be a better choice. And to do that, we talk about what's called competitor differentiation, digging into the metrics to show when you're looking at who your agency is compared to their agency and his patient population, what is the niche that you have that might be better than the competitor? Are my readmission rates better? And do I offer more nurse to therapy visits that helps contribute to that lower readmission rate? Is our average length of stay a little longer and we have less readmission rates, which also contributes to that? Do we start our care from discharge to start of care within the 48 hours? And does my competition do it in 4 or 5 days, which can open up the door for those patients to go back into the hospital, especially those with chronic conditions? Is my competitor only taking lower acuity patients, meaning those that are not as sick, and we take higher acuity patients? So taking a look at those and taking a look at the major diagnostic categories. Do we do a better job with respiratory patients, endocrine patients, musculoskeletal patients? Are we better with the lower acuity or the higher acuity? So looking at these metrics and doing the side-by-side comparisons between myself and the competitors and putting together this campaign and a strong message to have that conversation with the physician can show them, even though I've been working with this agency for many years, you guys are showing me with true data that you are a better choice for this cohort of patients that I have. So that's one strategy on the home health side. On the hospice side, I always tell folks, take a look at the number of visits in the last 7 and 3 days. When are the patients starting care? Is it earlier or later in the 30 days? Are they going to and from ER, OBS, and inpatient stays and back and forth? Does that particular hospice agency have a higher readmit rate and inpatient stay where they're going back and forth versus your agency where you're keeping them home and you have less of that? So there's a lot of metrics that you can utilize to build a strong argument to say we do a better job with this particular set of patients and we'd love to partner with you.
So it seems this group of physicians understands the value of the different care settings, home health, hospice, but they seem to have selected their preferred partners. And this is all about proving that you deserve to be part of that preferred partner group.
Correct. Correct. And sometimes it's a little bit of work because they're set in their ways. Sometimes physicians, they're really stuck. They've been with these partners for a long time. So you have to be mindful in your verbiage as to how you go about having those conversations with the providers. Always make it about the patient, saying, I want to do this for the patients. I want to partner with you so we do the utmost for your patients. And then always, and I've said this even on the last 2 calls, what do your patients need? How can we partner with you? What services do you need? A lot of times, again, physicians are busy. They don't always know that you've expanded your business or that maybe you're providing care in a new territory, a new county, or maybe your partner is now with the hospital that they're affiliated with and they didn't know that. Maybe you have a GIP there for hospice and they didn't know that. So always educating those physicians as to who you are and the services you provide is absolutely crucial.
Well, great. Well, that was really informative on competitor affiliated. Thanks, Teresa.
Thank you.
And if you're watching this and you have questions about what we just talked about, or you have a targeting strategy you'd like us to dive into, feel free to email me at jess, Jess, @trillahealth.com. Thanks, everybody.
Bye, guys.
Bye.